Hello, I hope everybody is trying to stay safe with this crazy virus out there. Sometimes a timely intervention is what it takes to save somebody's life. I have a little information that I want to share here. It's not a medication, it's not a treatment, it's just something that you can do in a timely manner. What they have seen with this virus is that it collapses your lungs, and that's why you see a lot of people, they have difficulties breathing and they end up on ventilators. And the reason is that there is something that this virus causes in you. It's called silent hypoxia. This means that your lungs are collapsing. Your lungs do not have the adequate oxygen that you need, but it doesn't indicate in your level of breathing. You do not show any signs of difficulties breathing. You do not show any signs of shortness of breath. That is why it's called silent hypoxia. And by the time you actually could tell visibly that someone is having difficulties breathing, their lungs have really collapsed a lot. And that's why when they end up in the hospital, they usually, most of the time, they don't survive. And I'm going to show you this little device. It's called an oximeter. It's used to check oxygen. This one is a portable one. You can find it on Amazon. They range from $15, $20, $30 depending on the quality. But it's very simple to use. You push this button and it's going to tell you your heart rate and your level of oxygen. My level of oxygen now is 96. Every human being with a healthy life, the normal range of oxygen ranges from 94% to 97 to 100%. 94% to 100%. To some elderly people, their normal oxygen will be between 90 to 93, which is okay. But at this time, we also see that these are the most vulnerable population for this virus, the elderly population. And if you can have this and you have an elderly person at home who is showing symptoms of this virus, they start coughing, please start checking their oxygen. Start checking their oxygen. At some point, their oxygen will start dropping. If it drops below 90%, let's say 88, 87, please don't wait for that person to start showing difficulties breathing or shortness of breath before you take them to the hospital. If their oxygen drops below 90, take them to the hospital right away. It's going to save a life. By the time you wait to see that they are actually showing those signs, it's gonna be too late. This is very important. This is all I have to say. I don't have any medication. It's just this that I wanted to talk about. I hope this helps. I hope this saves somebody's life. Thank you.